Why would anybody want to go into a profession that you have to keep explaining who you are and what you do? Why indeed? Because it's something that goes beyond all that. It goes beyond your identity. It goes beyond your pocketbook. It goes beyond your politics. It's a calling. You have to feel it. Nobody could made me do this job. Nobody could have made me want to be a midwife. You have to want this. You have to love it. It is what it is. I'm a midwife.
I'm Dorothea Lang. I was born overseas. I was born of missionary parents who went to Asia as pioneering mission work in the early 1930s. I looked at the midwife. I thought, here she is. A Japanese midwife was really the woman's healthcare provider in the community at that time. And she would walk down the street and the women would flock to her. They had such admiration. They all bowed when she walked by. They all felt they could talk and whisper to her the secrets they could never tell any other person. And so I thought, that's a kind of a person that can really help people. And they seemed to walk away smiling and etc. And as I inquired later, it was the midwife who really was the community's triage agent, I guess, in a way. And in such a way that she was listening to people's private, secret problems. And in those days, you know, Japanese women and women in general didn't talk about their private lives. But these women could share something with that lady down the street that I thought that would be wonderful to be able to get in on that kind of a business, or that kind of a commitment, I should say. So I was tolerant until he retired from that position and a new doctor came in, a chief, and to head up the program. And he said, let's try midwifery. So in 1968, it was approved by Washington as long as it didn't cost extra money. And so we did it, and we hired some of the midwives who were just coming out of school. And interesting enough, two of these midwives were my former nurses in the obstetrical unit. So I knew how good they were because I taught them and gave them the orientation in those days. Now they came back as midwives, and they were fabulous. There also was one other place by that time, a sister hospital, that had 2 or 3 midwives that had just started to work at that unit. And then there was also Kings County Hospital. The chief obstetrics at downstate decided, Dr. Louis Hellman, God bless him, he was so progressive. He said that midwives needed to be part of the obstetrical team. So he approved 2 midwives for Kings County Hospital, Cumberland Hospital, and there were also 2 going to Harlem Hospital. So this was about the 1967-68 years. It was wonderful in finding out that there were other midwives who were trying to be pioneers in the true midwife hospital-based movement.
I was born at home in West Virginia. I'm the oldest of 3 children. I was born to my father, James Henry Watts, my mother, Odessa Esmeralda Watts. Born at home, they always thought I was very alert, and I always felt pushed academically. I graduated from the University of Michigan School of Nursing in 1958. At that time, I was the only person of color in my class of over 250 when we began, and about 130 when we graduated. One of the things I really introduced to many of the programs was to have an open house for prospective students or interested students, because I found midwives of color really benefited a lot if they understood what was entailed and could ask questions in person about the curriculum, the hours, the expense, the demands of the program. And that I found helped when I was working as an educator. I got to know more about the personal social needs of the students, and the fact that you have to reach out, have to go to them. You can't always wait for the students to come to you and ask for help. You have to encourage them to work together, to seek help, not to be ashamed if they feel they're having difficulty and having some struggling. And I found, students were always successful if all of these things were taken into account. If they really knew what to expect and were able to prepare themselves, their success was a lot more guaranteed. So I found education to be very gratifying. I'm happy to see how many more people, students of color or graduates of color, are in the college now, because I went to the Long Beach convention a couple years ago, and I was able to attend the Midwives of Color reception, and I was so pleased to see this large room full of students and graduates of color at the convention, and having such a wonderful time, and it just made me feel just quite good. There's so much that midwives can offer, and it doesn't have to be confined to full scope care, nor does it have to be confined to clinical care. And so we have to find a way to use midwives who can continue to work until they're 80 if they wish. And I would like to see that come to pass. I think there's a lot more we could do.
I'm one of those people that believe they were called into it. My mother had a family medical guide, and there was a chapter in there on pregnant women, and I very much distinctly remember that you shouldn't vacuum when you were pregnant. I remember that being in the book. And I remember having Barbie dolls, and nobody in my family sewed, but I would take the Barbie dolls, take their heads off, take a triangular piece of cloth, fold it in half, cut a neck out, put it on the Barbie dolls, and stuff cotton balls up the front of the Barbie dolls' dress that I made them. I made them all pregnant. I was 8 years old. It very much concerned my mother that all my Barbie dolls were pregnant. And then I would take care of my Barbie dolls. I have no idea where it came from, but that's what I remember. And in 8th grade, I made a pictorial, drew pictures of fetus, and did a book. I have it still. We found it in the basement. I did a pictograph of developing fetuses in 8th grade. So where it came from, I don't know. I believe it's a calling. Well, I apply midwifery in growing the next generation. It's very important to me to precept students. It's very important to me to be nurturing of young nurses. And it's important to me to teach residents about physiological care. I think the other way we do is we kind of midwife the world. We do global midwifery. I think we're all about healthcare reform, opening access to women to get healthcare. And my funny story is I went down to the Coyote Ugly Bar, just got lost in downtown Nashville. And I walked in, and immediately my mind went to this young girl who was serving drinks behind the bar. And I looked at her and I said, "Do you have health insurance?" She said, "Hell no. I'm a waitress." And we got to talking. And I thought, this is a royal shame. So I think we tend to do things like that. It just comes up in our spirit.
There were a lot of reasons how I got to the point where I decided that I wanted to attend Women at Home. I was very fortunate. When I was 10 years old, my mom was pregnant with my sister, and she read Grantley Dick Reed's book, and this was in 1956. And while she was reading it, and I knew she was pregnant, I read it too. So my first exposure to labor and what you do about it was through Grantley Dick Reed's eyes. And he was a big proponent of home birth in England. He was a British physician who attended women at home, and he invented the term natural childbirth. That was his way of calling what he was doing. My mother, I remember descending the stairs outside of our house at about 6 o'clock in the morning on the 20th of October of 1956, and she had a whopper of a contraction when she got to the bottom of the stairs, and she held on to the brick wall that was a retaining wall, and then she turned and smiled at me, and she said, you know, she would call me and let me know soon. So that was my first impression of labor, and she seemed to be handling it very well and looking forward to it quite a lot. I'm a body person, so I enjoy, you know, working with my body, helping another person work with their body. So if hands-on is what's required, I love that. And it's hard for me to be in a room with a birthing woman without stroking or a touch. And that her body invites me to touch in the right spots. And that I can figure that out. That's a wonderful thing. It's such a gift. I'm happy with that gift. I'm happy with that gift.
You know, there's been such a long tradition in this country of structural violence against Native Americans that I think it's really an important part of healing in terms of some of the problems that those Native communities face, like alcoholism, drug abuse, domestic violence is really pretty rampant in those communities because of this long history of colonialism and structural violence. And so, you know, what these women are really helping to bring this message of strength and power back to their you know, fellow women in their communities. So I think it's really important. And some of the students that we've graduated are clearly going to be leaders in the profession. I mean, they're young now, they're in their 20s, but I really get the sense that, and I'm tearing up just talking about them because they're so incredible. That's a really, it's a good feeling. That's kind of where I am now in my career, is trying to move some of those ideas forward, because I'm seeing that I can continue to care for women, you know, one-on-one, but in many ways, I'm affecting things more by being at this more macro policy level. I guess I would say publishing. For me, that was a way to find my voice, because in many ways I'm better at that than this. I guess in writing, I really found a voice that was kind of buried for a long time.
I came back to New York and I finished college, and I went to find Ruth Lobick, who was an anthropologist and a midwife, but I didn't know anything about midwifery. And she sat me down and she said, "Frances, with your background in anthropology," because I got a BA in medical anthropology, and she said, "You really should look into this collection of women called midwives. It's not very well known. There's about 200 and something members." This was in 1974. And I said, "Midwives, you know." I said, "How do I do it?" And she said, "Well, you have to go to nursing school, and you have to work, and you have to go to get a master's degree." And I said, "Ruth, that's 6 years. I could be a resident, a doctor by then." And she said, "I know, but the good news is that you're not going to be a doctor." Well, because first of all, someone listens to them for the first time. They've been bounced around a system where people didn't care, and they're always the underserved and the forgotten. And it's nice to have someone dote on them and give them the kind of care that you would want to have for yourself, and you could finally give it to these inmates. You don't think of them as inmates, but as patients. Every woman deserves the time-honored care that midwives give their patients, and prison is no exception. I see my role, I have an endowment for leadership in my name. It's the foundation, and it's for leadership endeavors and to reward midwives for their leadership roles. And I see that as self-perpetuating into a legacy where I'll have a direct role in nurturing new leaders, leadership strategy, potential, and I can literally tap into the system where I have a role to play in picking and choosing, and after I'm not here, a legacy will go on, and it will always be to help midwives strive to that higher place.
Before we started the certified midwifery program, we decided to do a little research, and we applied from the ACNM Foundation for funding to do a pilot project to try to compare the process and outcome of the nurse midwives and midwives, the way that they go through the education process. And it was a good thing that we did that research project, because later on, when the certified midwives needed their accreditation, and when the program needed its accreditation, we had to go to the state education department at the federal level to apply for this. And it was a good thing we did the research project. And then we had some evidence to show that indeed there was no difference in the way they were educated, in the way they practiced. I do not know the exact number, but I wish we had more Asian midwives. For some reason, many of the young Asian, the second or third generation Asians, they don't seem to go into midwifery, even though there are quite a few numbers of men and women, they enter into the profession of nursing. So I think it's probably less than 1% of the nurse midwives or midwives in the United States are Asian in origin. Before my retirement, I worked at State University, New York, Downstate Medical Center, and we did have a few Asian students and graduates, and some of them are still practicing, but really we should have more Asian midwives and nurse midwives in our profession. I would say I learned so much from our pioneers. I always value my reading of the literature, their viewpoints, their philosophy, how midwives think, work, and do things very differently.
This sounds odd to say, but I do think my writing and talking about midwifery is probably the most fun. And that sounds weird, because how fun could delivering babies is fun. It's really fun. But to be able to inspire people, inspire other midwives, inspire patients and just general readers, I think that it would be the highlight, really, of my career. It's funny, I don't think of it as a career exactly, but, Well, it's a wonderful job being a midwife. Even in the office, in the clinic, what kind of job do you get 8 or 10 hugs a day. I mean, isn't that incredible? I initiate a lot of hugs, but I get them back too. And you think, what other job would you do this? And why would you want to quit? Now, being up all night, there is a certain point where a lot of us do quit. It gets to be hard on you. But ours wasn't for that. But, now that I think about it, would I go back to being up all night? It'd be hard for me. It's a wonderful job. It's interesting. I was talking to somebody yesterday about the transformative power of birth. And I was talking about how it can transform a woman, to learn about your own power, to go through pain. A lot of people don't believe in that, but you go through pain and you come out stronger. And there may be a function in that to make people more spiritual or just maybe physically stronger, I don't know. But there's also transformation in the midwife, I think. The person who gets to be there and gets to see that. And also, like I said, we have to be brave, So maybe that's where some of that light comes from, I don't know.
Probably for almost every midwife who is in a committed relationship, that partner is extremely important to success, because midwifery is really hard. It's very hard work. It's very rewarding, but it's really hard work. And as my husband said to me one day, I think we were out in a canoe in Minneapolis, and of course I had my pager on and I was on call for all the women that I was caring for, and he just said, you're really married to your beeper. It's very challenging work, that birth is just not scheduled. And so really being available to women at a deeper level is the privilege, and it's also the emotional what it takes emotionally really to be there. So you need to have in your relationships and in your family, really people understand that. Centering has been it's just been transformative for so many people, and it really is. It's really quite gratifying to come to convention and hear different presentations and see posters and have students come up and say, oh, wow, I can't believe I'm meeting you. And it's like, yeah, because it's just, it's been just a really natural thing to do. And it's just, I totally believe that this is the best way to give and receive care. So very passionate about groups and the power of groups.
The heart of midwifery is how we treat patients, how we are with women. It's very, very different than how most obstetricians are or most physicians are, because they're trained on the medical model. And since nurse midwives are trained as nurses, and I believe that lay midwives or CPMs or whatever they're calling themselves also have a holistic approach to patients. And they're not just interested in how the contractions are right now, they're interested in who's going to be with you, and you got kids at home, who's babysitting for them, and what's going on, and when you leave the hospital, do you have enough diapers and baby clothes to take care of your baby, and are you going to be able to come for your 6-week checkup, and all of that. It's a matter of support. It's exactly what centering pregnancy is about in a nutshell, which is being with women and being able to support them.
I was happy to see some men come into midwifery, and the men that I worked with as students were really good men who were interested in helping women and in providing women's health care that was also coupled with empowerment and respect for women's capabilities, and to enable those young men to achieve that pleased me as well. And I'm glad when I see them being successful. Well, I think one acquires those opportunities, by virtue of, first of all, getting well educated, learning what the nature of the issues are, and being able to address them. That's why I did research on some of the most basic dimensions of practice. It's almost laughable. In fact, my own stepmother was shocked when I told her what kind of grant I had funding for, and she thought that the fact that public money was going to pay for such research was just, she just was quite indignant about it, because it's so basic. I don't need to go into all of the research I did. Anybody who has access to the literature can see what that is. But it was very basic, but it was persuasive.
I went to the Frontier Nursing Service, and I think I went there for the same reason that many people did, looking for autonomy, looking for the ability to learn my work and to be allowed to do it. That's what I was looking for. And a little romanticism about horseback, because I was a big horse lover. And at that time, of course, they were not using horses. This was in 1969. So they let me think, though, that they were, because they needed someone with my credentials to teach the pediatric portion of the very first family nurse practitioner class. So they let me believe that I'd be working on horseback until I got there. And then Miss Brown broke the news to me, and she said, "We really needed you." So she said, "But if you want to go out and do some of your work on horseback in the district, you can, because we do have horses still at Wendover." And so I was able to do that. Miss Leaf dug out some old uniforms. And so I did part of my work there still on horseback. I could talk to you for hours about the Frontier Nursing Service and what it meant and all of the incredible experiences I had there. But when I was going out on horseback, the first thing I saw was people, the older people, would come and see me coming to their cabin and weep. And then they would tell me these heartfelt stories about the impact that various midwives had on them, and what a midwife meant to them, and what the FNS midwives had meant to the people in that area. And it's hard to talk about it in midwifery, particularly with people who've been working a long time in global health, because it comes out critical, and that is not the intent. It's sort of, how do we find that humility to say, we went at this with our best intentions, but we need to now listen more, and that's the heart of midwifery, is listening to each other and to the people we serve. That's it.
When I opened my birth center, one of the things that we did was provide gynecological health care for women with special needs. And that was a huge thing. That's a highlight of my career, because this is a population that they just had gotten horrible care. And these are women that, many of them were difficult to look at. They were severely physically challenged. Some of them, their body was all twisted up. They couldn't speak. Some of them had no vision. And we were able to take them up into the birth rooms and do their gynecological exams in a very safe, sensitive environment on the bed. And when I became a family nurse practitioner, I interviewed with a very dear man who cared for people with special needs. And my gynecological background in caring for people with special needs transferred over to that practice. He had a huge commitment to that population. So that's something that I miss, and is something that I really cherish, and hope those people that I served are still getting good care, because there's a really big gap there. And we're uniquely suited, I believe, to care for that population, because we are so sensitive and we're flexible, and because the hallmark of midwifery care is listen to women. I mean, I was able to transfer that when I was seeing men with special needs when I worked in internal medicine. It was just everything, all the principles were the same. We even put a ramp in at the birth center for people, make it wheelchair accessible.
Sometime in 1970 or so, I came across an article in a magazine just by chance about modern midwives, and it was like this light went off, and I said, that's what I want to do. That's what I'm meant to do. And that started me on a long path to my career as a midwife. The first birth that I did for one of my HIV patients. I was on call and they called me in, and I got there just in time for her to start pushing. When babies are born, there's usually this feeling of joy and relief and all mixed in together. But when I gave the little girl to the mother to hold, it was as if I could feel the mother's mixed emotions. Well, do I dare to love this baby who could die? Will I be around to see this baby grow up? It was very powerful, very powerful. I think one of the most interesting experiences I had as a midwife came when a psychotic woman was brought into the hospital where I worked. She wouldn't let anybody come near her. She didn't believe she was pregnant. The doctors were all stumped. She wouldn't let them do a vaginal exam. And having learned from Lily Shaw, always ask the patient, I simply said to her, "Hi, how are you feeling?" to elicit from her what the problem was. And she had, "Oh, I have a terrible stomach ache." So by finding out her perception, I was able to address that, her stomach ache, and care for her. And she safely delivered a baby boy, not conventionally. She gave birth on the floor in the hallway. Very little help was needed from me, but at least she wasn't tied down like an animal.
I have the dubious distinction of being the first African American midwife to graduate from the first school of midwifery in the state of New Jersey. Well, that and $1.50 will give me coffee at McDonald's. The thing was, it wasn't so much the distinction of being the first African American, but it was the distinction of being in the first class, in the first school. I had been thinking for years that there needed to be something. We had the misfortune, and I don't know if any of the other speakers of color spoke to the issue of there was never a quote place for African American, Hispanic, Asian midwives for them to talk about the issues, for us to talk about the issues that were important to us. We used to meet in hotel rooms. We were sitting on floors and sitting in bathrooms and sitting on dressers, and everybody would pack into this room at convention, and it would be like 50 people in a typical small hotel room. And the purpose was the camaraderie and the ability to talk about the things that bothered us and that we needed to talk about without fear of reprisal. And that was so critical. I spent a lot of time at work, time that I should have been spending with my children. That's my one regret. My son was older. He's like 13 years older than my daughter. But my daughter was 4 when I went to midwifery school. Because she wasn't 4 yet. She was almost 4. But I remember one day she's sitting on the porch playing with a friend, and her little friend lied down on the ground and was holding her knees like she was giving birth, and she was like, So I looked at my daughter. I said, "Aren't you going to help her? Aren't you going to do like Mommy does and be the midwife?" And she said, "No, because midwives don't have time for their little girls." And that was too much. So you sacrifice a lot as a midwife because you can only, there's no half doing it. You don't have to midwifery. You're either all in or you're all out. Why would anybody? But I think people go into midwifery because it's a calling. It's like a religion, really. It has nothing to do with money, because you can't get rich doing this. There's no logic because you're in a profession that is politically a football hot potato. You have an identity crisis. A lot of people don't know what we do, what we are. I mean, why would anybody want to go into a profession that you have to keep explaining who you are and what you do?
I said to a midwife yesterday, she said to me, how did you do it all? I said, well, every time I'm a weeble. I weeble, I wobble, but I don't fall down. And you just pick yourself up, dust yourself off, and get back in the race. Just do it. I said that to my kids all the time. And by the grace of God, they're all doing great too. You know, they came out great. My baby's going to go become a midwife. I love it. So excited. You just do it. If it needs to be done, just do it. I was on the ACNM Foundation, and they gave me, after 6 years of service, they gave me a present for serving on the foundation. And what the president said to me is, she'll never forget my attitude and my words of, just get it done. Let's just do it. Because that's the way I feel. I've delivered 7,000 babies. Well, hopefully I can do more than that. I definitely want to practice for another 10 years. So that'll be a total of 48 years. So then if you practice for 48 years, maybe you should practice another 2. I don't know. We'll see. We'll see. I'm hoping that I'll be able to.
So that was some of the things I did while I was in St. Louis. I also, while I was there, I worked at the jail. The director of health said, you know, Gene, I wish you would go down and check that jail out. He says, I think they're not getting any health care down there. Could you see what about it? So I did, and for 2 years, I went once a week to the jail to give prenatal care and well women gynecology care to the women in the jail. And I used to take my students with me so they could have that experience that, you know, we have to take care of everybody, not just the white Caucasian or the highly educated person, but the drug addicts and all of that. So we did, it was a wonderful, I loved it. I really did love the working with them, with these women, and you know, then they'd be out on the street and they'd always come up and talk to me, and I couldn't remember if it was a patient from the hospital or the jail. I'll never forget that. They were just, you know, you got to know your patients so well. That's one of my greatest joys, and it's because, and that's midwifery at its finest. That's my caveat. Midwifery, because we are with women through all events of their life. And we stand with them, and we support them, and we love them. And that's what midwifery is about. Amen. As long as I can live and get moving, I'm happy to do it. I love it. I would die if I didn't have it. Midwifery has been my nourishment. My spiritual life, of course, and my religious life is foundational to who I am. But midwifery is what drives me. Yeah, it's a good place to be.